So this is continuation from postural therapy. Postural therapy is basically keeping tissues from falling back into the airway under the influence of gravity. And so laying on your side obviously makes a lot of sense over laying on your back, because if you're laying on your side, yes, it does fall back, but not as obviously as the tongue would fall back in the supine position where the patient's laying on their back. This continuation is tissue fluid, and not a lot is spoken about this, but there are some studies, and they are actively investigating this. And what this revolves around is, you know, lots of times, especially older people, will get swollen ankles, been out shopping and in the good old days, and when you get home you sit there, and unless you sit with your legs elevated, you may get pooling of tissue fluid in the ankles and swollen ankles. So it's reasonable, therefore, and it depends how good your venous return to the heart is, but it's reasonable, therefore, to assume that generally there will be more tissue fluid the further down you go. And so when you go to bed, if you've got all this fluid in the lower extremities, when you lay flat in bed, there's a tendency for the redistribution of that fluid, and it actually can flow into the neck, and it can worsen by increasing the extra airway volume. The tissues and the tissue fluid outside of the airway can increase the pressure on the airway, thereby increasing the chances of collapse. So in English, what that means is when you lay down after being upright for a long time, any tissue fluid in the lower extremities will tend to flow into the upper extremities, which also includes the neck, which could also worsen or aggravate obstructive sleep apnea. And it has been shown to do so. So what are you going to do about it? Well, it depends. It's difficult if you're on holiday and you're spending the day on the beach, because you don't really want to wear pressure socks or pressure stockings. But having said that, there has been shown to be some advantage with the same kind of pressure socks and leg attire that people use to try and prevent DVTs when they're on long flights. So wearing those during the day and taking them off right before you go to bed will tend to work for you, in that instead of being the tissue fluids in the lower extremities and flows to the upper extremities and potentially the neck, then it will allow fluid in the body, tissue fluid in the body, to redistribute to the lower extremities, thereby taking it away. So it's just a little tip more than anything else. They are doing some studies on it, and it could very well be that in the future we see this as an adjunctive treatment. But it's something worth trying, because it's relatively inexpensive and it's not very inconvenient, all things considered, and it may be something that fits into the picture. So just throw that in as another adjunctive option for therapy.